Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCPLive. Hosted by SOC's leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally intelligent and responsive practices, and other news important to treating patients of color. Today's episode will feature SOC's member and mentor, Dr. Aleta Simmons, who will focus on the power of mentorship and collaboration in medicine. Dr. Simmons, please feel free to tell us a little bit about yourself.
Hi, I'm Dr. Aleta Simmons. I live in Nashville, Tennessee, where I'm the owner and founder of Simmons Skin Center, where we take care of all your dermatology needs. I also have an online platform called Get the Skinny. I do blogs, webinars, and other educational activities like workshops and speaking around the country to educate patients about all of their dermatology needs or questions that they may need more help with. And I also host a podcast called The Gorgeous Plate with one of my friends, Tiffany Sutton.
Excellent. Well, thanks for sharing that. And Dr. Simmons, I know you've been very involved in mentorship as a way to sort of give back to the profession. So we'd love to hear from you about your thoughts on the value and benefits of mentorship experience and both the mentors and mentees perspective.
When I think about my mentor journey, I started out being a mentor, and I think fourth grade, they paired us with kindergarten students, and that was my first introduction. And I think I took it as this is a part of life. You need a mentor, you will be mentoring other people. And so helping people get to where they want to go and reaching their goals is something that is very important to me. And one of the biggest things that I think about in the mentor-mentee relationship is working on those goals, but working on them together. My approach when I work with my mentees is to look at their goals and help them create a strategic plan. I often find that students are overwhelmed, and I really enjoy meeting a student in that place because that's when I can really make them feel empowered and letting them know, like, this is attainable. You want to be a dermatologist, it can happen for you, but we have to take some steps and be strategic about them and putting them in connection with the people that can help them as well. And as a mentee, I think that in the beginning, I really didn't know how to be a mentee, but over the years, I really found that having goals and things to discuss with my mentor every time we meet was important. And I have my mentees make an agenda. What do you want to discuss when we meet? How can I be of service to you? And where are some gaps that you may need filled? Because one mentor is not your go-to. I think you need several. There are different types of mentors, and having that discussion is going to really help that student be able to fine-tune what they really need to get to where they want to go, and then find those resources when they need more help.
Absolutely. Those are some great points. And I really like what you said about meeting them where they are. I feel like that's a crucial part of mentorship. So it's amazing. Okay, so then that kind of leads me to my next question. You touched on it a little bit there, which is feel free to walk us through what a mentee would typically experience with you during a mentorship or observership in your office and what kinds of activities your mentee might be involved in.
That's a good question. My mentees probably do a lot of different things depending on what they need. I keep 2 appointment slots per week in my schedule for mentees. So Tuesdays and Thursdays, I'll meet with students when they need to meet. I live in Nashville and Meharry is there. Meharry doesn't have a home dermatology program, and I created those spots specifically for them to be able to have time to meet with me. But I meet with students all over the country. And when they make an appointment, they have a questionnaire of where they are in school, what year they are in school, and what some of their goals are and how I can be helpful. And from that, when we meet, we go through those things one by one. And as I listen to students, one thing I'm doing is alleviating fears and then helping them create a plan for when we talk next, we have some follow up, almost like homework. So expect to get some homework when you meet with me as a mentee. In my clinic, when people come, it's usually like an observership where the first day students are watching how we flow, what we do from day to day. And then as they get more comfortable and as I get to know them and we work together and I understand what they want to get from an observership, they get to have, a little bit more freedom in helping out. If there are topics that I find they're more interested in or ask more questions about, I'll give them resources and say, these are some things or some places you can go to learn more about this subject. Go learn about it and then come talk to me about it afterwards. I think that's really helpful in them developing their interest, because I remember being a medical student and thinking, I'm interested in dermatology, but dermatology is so big. And the question is, what is your niche? What are you interested in? And for someone like me, I was interested in everything. Everything excited me, and I think that that's where students are. And when you talk to a student who's just learning, they don't even know how to approach the field because it's so vast. And I give them strategy on how to take a dermatology book, look through it, and see what piques their interest, and then how to take that interest and develop it more. And I think from that, they're able to really think about, well, I know I need to do research in dermatology to match. This is how I find out where I may want to do research and who I need to contact in order to make those connections and get that research published.
I see. Okay, that's great to hear. Yeah. Well, okay, so then please feel free to share us kind of I guess, an example of a particularly rewarding moment that you have experienced as a mentor.
One of my most rewarding moments as a mentor was actually working with a young woman who I still work with and keep in touch with. I met her at a student national medical association meeting, and she expressed her interest in dermatology, but also where she wanted to end up in terms of residency. And we just formed that connection then. And I followed her through matching through her dermatology residency. And now, as an attending, getting ready to transition into a fellowship, we have probably lots of rewarding moments over the span of, oh my goodness, it's probably been 5 or 6 years now. But the most recent one was helping her negotiate a contract. That's something that we typically don't learn a lot about in medical school or in our residency, but to think about your value and your worth when you're taking on a new job, taking on another day of clinic, and just having that guidance. So I talked her through it. She was hesitant to ask for what I suggested. So she laid it somewhere in the middle. But when she actually had her meeting, she felt empowered to go and ask for that higher number. And she actually got it. And when she let me know, I was so excited because it's something that I've watched her all through her career, and to get to a point where she's actually negotiating for her value and her worth and putting in great work at the institution where she is just very fulfilling to see. And I'm really excited about her future and what's next for her.
Absolutely. I can definitely see that. And that's such a great point too, the idea of knowing your worth. I feel like as a mentor yourself, that probably is something that, I mean, I don't know, but I assume not every mentor is teaching their mentees, right? It's like how to know your worth and how to know the kind of thing you should be asking for in a contract, for example. I mean, that's such a
Exactly.
good point. Okay, well, yeah, I'll ask you then, because I know SOX has a well-established mentorship and observership program or set of programs available to physicians in training who are members. So, for anyone who's thinking of becoming a mentor, feel free to share your insights on how to make this opportunity as meaningful as possible.
And I think another thing that would be able to make that observership even more powerful is going ahead and carving out meeting times in that first session, establishing how often you want to meet. Some mentees want to meet once a month, once every 2 months, once a quarter, talking about that, and then really deciding as a mentor how much time you have to dedicate, and then schedule those meetings out, even if they need to be changed. But if you could schedule out meetings for the next 6 months or over the course of the next year, that's going to make sure that rhythm and that cadence is really kept up with. Because what happens is you get busy. A student is busy and on rotations or in courses, taking exams, and sometimes meetings don't happen when you want them to. But if you have a system in place to really make sure that you're meeting with your mentee on a regular basis, and as a mentee, you're checking in with your mentor, I think that's going to enhance the relationship because those touch points aren't missed. And that's how you really make sure that those goals are met because you're meeting more frequently.
Yeah, that seems like a very good point to have. I feel like maybe a lot of mentees could stand to hear that and to know that that's the kind of thing that you should be checking in on occasionally. And then, okay, I would love to know as well your advice to mentees about how they can get the most out of their mentorships.
Open communication. I think that mentees are often hesitant to reach out to a potential mentor, someone who they're already in a mentor-mentee relationship with. If they take that intimidation away and think about, this is someone who's here to help me and facilitate me reaching my goals, that will help them to be able to communicate more clearly, be able to talk to their mentor when they do have problems, because we're not only here to help you reach your goals, but to navigate those issues that may come up as a student. They happen all the time, and often students suffer in silence. But if you have a mentor, we're here to help guide you through those hard times and give you advice on how to approach them. I would say to mentees, work on taking away that fear and intimidation from talking to attendings and your mentor, and know that we're a source of help and assistance, and we can provide you with resources. So don't hesitate.
That's such a good point too. Is that something that you often highlight with mentees, the idea of not being afraid to sort of, like you mentioned, right, asking for what you need, knowing your worth, and then also talking to people that you might be a little more intimidated by? Is that something that you touch on usually?
I do, because I was there. I'm leading from example. I remember sorry. I remember being in medical school and wanting to have a meeting with our dermatology chair, Dr. Rebecca Tung. And I was so afraid of that meeting that I delayed it and delayed it. And when I finally met with her, she was so nice. And she sat down with me, and she's the one who really helped me develop my strategy and helped me realize how important that is. And I kept thinking to myself, why didn't I do this earlier? Why was I so afraid or intimidated when, she's opened her door to me and has welcomed me? And I think that without having that meeting with her, my trajectory in terms of getting into dermatology would have been a lot different. And I want students to know it's okay to meet with the leadership at your school and at other schools to express your interest in dermatology. People are busy, yes, but people will make time to help you.
Absolutely. Well, that's such a good point. Okay, well then switching gears, let's talk about the importance of collaboration with your colleagues outside of dermatology. What other specialists do you consult with on behalf of your patients?
I think in dermatology, we probably consult almost everybody. There's so much overlap in all the specialties. We don't practice medicine in silos. We practice medicine together, whether it's talking to their primary care physician about their blood pressure medications because it's going to affect the medication that I'm giving, or a rheumatologist because we share a patient who has lupus, orthopedic surgery, plastic surgery. We're all consulting these different specialties in order to take good care of the patients. I recently had a patient that developed a rash. She had a history of lupus, but the rash wasn't in a sun-exposed area like you typically see with lupus. And I had to work with her rheumatologist to go over her medications because she ended up having a drug allergy to one of the medications she was taking for lupus. And that conversation is very important because she was allergic to some of the other medicines as well that she'd been on for lupus. So we had to work together to find a solution for the patient that would work.
I see. Yeah, that does seem to be the feedback I've heard from a lot of dermatologists is everyone is being consulted. There's relationships to diet, there's relationships to, every different kind of a subfield you can imagine.
I refer my patients who have hidradenitis to nutritionists as well because nutrition can play a role in all types of skin diseases, especially those inflammatory conditions. And for my patients with psoriasis, I make sure that they have a primary care physician because they oftentimes are at risk for cardiovascular disease. And I want to make sure that the whole person is taken care of.
Okay, so what would you like colleagues in other specialties then to better understand about the dermatologist's perspective on the health and well-being of the whole patient?
Dermatology is more than the surface of the skin. It's deeper than that. We're often seeing conditions that are manifestations of internal disease. And it takes the dermatologist's keen eye to the visual aspect of disease to really clue in on what's going on. Sometimes we may see the manifestation of the disease before the labs change or before someone else is able to pick up what's going on. And I think we pick up on many common conditions that are signs that inflammation is occurring in the body. And once we get a control on that, help with stress management, medications, and lifestyle changes, we can see a difference in a patient's life.
Absolutely. So it sounds to me like everyone should be consulting dermatologists, not the other way around.
Well, we work together, so it's a two-way street.
Fair enough. Well, I see you have a podcast of your own, and I'd love to hear a little bit more about that. I have listened to a little bit of it, but yeah, feel free to tell our audience a little bit about it.
Yes, I have a podcast called The Gorgeous Plate with Chef Tiffany Sutton Taylor. She's not only a chef, but she's primarily trained in food science. She's a food scientist that was working in her career that decided to go to culinary school while she's working as a food scientist. And whenever we would talk on the phone, we always had these in-depth discussions about food, nutrition, and how they tie into skin conditions and beauty. And I told her, we need to make this a podcast because it's always so interesting and I learned so much from her. And we finally decided to do it. And it's been really fun just talking about where our industries intersect. It's always interesting how there's a connection between the two. We have a podcast session on zinc and how zinc can affect the body when you don't have enough, where to find it, but also how zinc is incorporated into sunscreens. There's always a connection that we find, and I find it fascinating.
Well, okay, so what do you hope listeners will gain by listening to The Gorgeous Plate?
I hope that they take something that they can use in their own life, even if it's just one tidbit that makes their life easier. It may take the stress off of food choices or knowing, your skincare routine can be simple. It doesn't have to be a 10-step process, but also thinking about what to avoid in foods. What types of things should they be mindful of when they are choosing skincare products? When to see a board certified dermatologist and how to make that appointment with your nutritionist to see, where can I do things differently in my diet?
Absolutely. Yeah. Good points all around, especially given, I think, a lot of people's focus on this topic. I think it's a great one to know, and I hope they check it out as well. Well, we'd love to close with your favorite pearl of wisdom to inspire your colleagues, so feel free to share a thought that's been meaningful to you in your journey.
I always remind my students that I work with that they are a human being. We can get caught up in being humans that are doing, but we also need to be. We need to take care of ourselves, not only in our home life. We think about self-care and the things that we can do to make our day flow better at home, but what can you do at work to also take care of yourself? This became really important to me while I was in a coaching program with Dr. Kimmy Dahl, and she talks about self-care at work. And I think I really try to embody that, and I try to get my students to start early because medicine can indoctrinate you to be so self-sacrificing that it's to your detriment. And I want to remind people that we have to take care of ourselves too. And if we don't, it's going to be harder for us to take care of other people. So pour into your cup and make sure your cup is full. And then you go share the extra with someone else.
All right. Well, that's a great place to end on, Dr. Simmons. Thanks so much for sharing that. I hope our listeners go check out The Gorgeous Plate. Thanks for sharing your expertise today. And to our listeners, we hope you found today's episode enlightening. If you're interested in learning a little bit more about the work of the Skin of Color Society, visit skinofcolorsociety.org. Don't forget to subscribe to HCPLive's newsletters and follow us on social media to stay up to date on the latest in dermatology and more. We'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. And until next time, take care and thank you for listening.